If you are taking Trazodone for sleep or depression, this is something you will definitely want to pay close attention to. Many people are told that Trazodone is a gentle or safer option compared to other medications. And while that can sound reassuring, it's only part of the story. The truth is, Trazodone affects several systems in your body, and some of its side effects can take you by surprise. In this video, I will walk you through what you need to know. From the rare but serious side effects you should never ignore, to the more common, everyday symptoms that many people experience without realizing they're linked to the medication. My goal is to give you clear, honest information so you can better understand how Trazodone works in your body and make more informed decisions about your health. Welcome back to the channel. And if it's your first time here, don't forget to hit that like button and subscribe to the channel. Number 1. Prolonged erections or priapism. This side effect surprises almost everyone. Trazodone can cause priapism. If you are not familiar with that word, it means a prolonged and painful erection that lasts several hours. And no, this is not the kind anyone wants. So why does this happen? Well, priapism happens because Trazodone can affect alpha-adrenergic receptors and blood flow in the penis. It relaxes certain blood vessels, which is helpful in some ways. But in very rare cases, it traps blood instead of letting it drain. If that happens, it needs immediate care to prevent long-term damage. Even though this side effect is rare, it is important to know it is possible, because you do not want to spend time wondering whether it is serious. So if you are a male taking Trazodone, even at low doses for sleep, and your erection lasts 4 hours or longer, do not wait. Get medical help right away. Number 2. Serotonin syndrome. Now, Trazodone increases serotonin in the brain. That is part of how it works. The problem comes when you combine Trazodone with other medications or supplements that also raise serotonin levels. When too much serotonin builds up, your body can enter something called serotonin syndrome. This is not common, but when it happens, it can be serious and even life-threatening. So what are the symptoms? Well, early signs include sweating, shaking, a rapid heart rate, muscle stiffness, and unusual agitation or confusion. Some people describe it as feeling wired and sick at the same time. The biggest trigger to this side effect is when taking Trazodone with other antidepressants, certain pain medications like Tramadol, certain migraine medications, St. John's wort, and some recreational drugs. So if you are taking other mood or sleep medications, this is something worth discussing with your doctor or pharmacist so you know what to watch for. Number 3. Heart rhythm problems or arrhythmias. Trazodone can affect the heart's electrical rhythm, specifically by lengthening the QT interval on an EKG. In simple terms, that's part of the electrical system that keeps your heart beating in a steady rhythm. When it's stretched out, the heart can become more prone to irregular rhythms. Trazodone does this by blocking certain potassium channels in the heart, which slows down the heart's electrical reset after each beat. In rare cases, it can lead to a serious rhythm issue called torsades de pointes. The risk of this happening goes up if someone has low electrolytes, an already slow heartbeat, existing heart disease, or is taking other medications that also prolong the QT interval. Some of those medications include certain antidepressants like citalopram, antipsychotics such as quetiapine, and antibiotics like azithromycin, clarithromycin, and levofloxacin. If rhythm issues do occur, you may notice sensations like fluttering in the chest, skipped beats, or sudden bursts of rapid heartbeat. Number 4. Increased risk of bleeding. Taking Trazodone can increase your risk of bleeding. And here's why. Serotonin does not just affect your mood, it also helps platelets do their job in the clotting process. When Trazodone changes serotonin levels, it can make clotting a bit less effective. Now, this matters even more if you are also taking medications like ibuprofen, aspirin, blood thinners such as Xarelto, or even certain herbal supplements like garlic or ginkgo. So watch out for easy bruising, nosebleeds, bleeding gums, or blood in your stool. Number 5. Low sodium levels. This side effect is more common in older adults, but it can happen to anyone. Trazodone can lower the sodium levels in your blood, a condition called hyponatremia. When sodium drops, your cells pull in extra water to compensate, and that can lead to swelling, including in the brain. You do not need dangerously low levels for symptoms to show up. Even a mild drop can cause headaches, confusion, muscle cramps, irritability, and in more serious cases, seizures. So if you are older, taking diuretics, or dealing with kidney issues, this is especially important to keep in mind. A lot of people do not realize their symptoms are linked to their medication until a simple blood test uncovers the issue. Number 6. Blurred vision. Trazodone can cause blurry vision, and there are a few reasons why. First, it has anticholinergic effects, which can interfere with how your eyes focus and may briefly slow the nerve signals that control the lens. It can also make your pupils a little larger, which reduces sharpness, especially in bright light. Some people also notice dry eyes while taking Trazodone, and that dryness can scatter light and make things look hazy. On top of that, Trazodone can lower blood pressure, so if it drops too quickly when you stand up, you may get a moment of blurred vision. The good news is most of the time they are usually mild and temporary. But if you ever experience sudden, severe, or painful changes in your vision, it's important to get medical attention. Number 7. Drowsiness. This one is obvious, but there is more to it than most people realize. Yes, taking Trazodone makes you sleepy. That is why it is recommended to take it at night to help with sleep. But for some people, the sedation is too strong. It lasts longer than expected. They wake up heavy, slow, or foggy. If you have ever taken Trazodone and felt like you lost the whole next morning, you know what I mean. That sluggish feeling can linger, especially if the dose is higher or if you take it too late. This can be managed by taking it earlier in the evening. Lowering the dose with your doctor's guidance or adjusting your routine can sometimes help. Number 8. Dizziness. And along with drowsiness, Trazodone can cause orthostatic hypotension, which is a fancy way of saying your blood pressure drops when you change positions quickly, like when you stand up quickly after sitting for a while. When that happens, you might feel lightheaded or even like you are about to faint. This side effect can be especially risky for older adults, since a sudden drop in blood pressure can lead to falls before you even realize what's happening. So if you are taking Trazodone, take your time when you stand up. Move slowly, move intentionally, and give your body a moment to adjust. Number 9. Dry mouth. This may seem like a minor side effect at first, but it can get pretty uncomfortable. Trazodone often reduces saliva production, and that can leave your mouth feeling sticky, dry, or even chalky. That dryness does not just affect how your mouth feels, it can also impact your breath, your sleep quality, and even your dental health. Over time, it may lead to issues like tooth decay, gum irritation, or persistent bad breath. So if you've ever woken up feeling like cotton is stuck to the inside of your mouth, this is probably the reason. The good news is there are simple ways to manage it. Sipping water, chewing sugar-free gum, or using a mouth spray before bed can make a big difference. You can also try saliva substitute products, like biotin, to help keep your mouth comfortable through the night. Number 10. Nausea. This is actually one of the most commonly reported side effects of Trazodone. It often happens because Trazodone can irritate the stomach, especially when you are first starting to take it. Some people notice a wave of nausea shortly after taking the pill, while others notice it more in the morning. But here's the good news. This usually fades as your body adjusts, but in the beginning, it can make the medication harder to tolerate. So to make things easier on yourself, you can take it with a small meal or using a lower starting dose to help calm your stomach. And there you have it. Remember, knowledge is power, and you have the power to make informed choices for your health. Thank you for watching.